Attendees are in listen-only mode.
Hello, everyone. This is Bill Betancourt with the Center for the Study of Social Policy, and welcome to this Get Real webinar. Before we get started, just the usual logistical kinds of things we want to go through. Next slide. If you're calling in, please call in from a landline and do not use the mic and speakers from the computer, if at all possible. That helps with the sound quality. Also, when you call in, if you have a problem with the sound, hang up and dial back in, because sometimes that will correct the problem. This webinar is being recorded, as always, and we will send out a link after the webinar to everybody. For the recorded version, we also post it on our website, getrealnetwork.uyc.edu. Next slide. During the webinar, we will collect questions and answer them at the end of the webinar. So as the presentation is going on, please use the feature in the control panel to send in questions. And also, as we are doing the question and answer session, you can also continue to send in questions. After the webinar, you'll get a follow-up email with a survey, a brief survey. We hope that you will respond, because your response really helps us as we move forward with developing and scheduling webinars of interest to you. And also, we like to hear how each webinar worked for you and was it helpful. So, our presenter today is Adam McCormick. Adam is an assistant professor at the University of Texas, El Paso in the Department of Social Work. And in that university has a number of hats. He's the director of the MSW program, and he also serves as the director of the Child Welfare Training Collaboration and the Borderland Children's Behavioral Health Initiative. Welcome, Adam.
Thank you, Bill. I'm excited to talk a little bit about some research that my colleague, Dr. Catherine Schmidt, and I have done here in Texas, and in some interviews that we've done with kids also in Illinois and Iowa. I shouldn't say kids, I should say young adults. But we did we're doing a series of 3 studies, and this is the first kind of smaller study that we did, a qualitative study, really looking at the experiences, kind of comparing the experiences of youth who had accepting foster family experiences to those who had more rejecting experiences. So you notice in the title that it's limited limited to gay and lesbian youth, and that wasn't our intention at all. We certainly opened it up to all LGBTQI populations. However, the feedback that we got and the individuals who were willing to take part in the study and be interviewed all identified as either gay or lesbian. So that certainly wasn't our intent in the beginning. But everybody who was kind of referred to us identified as gay or lesbian. So we wanted to look first at what the research told us about gay and lesbian youth in the foster care system and what some of those experiences are. So we certainly looked at a lot of the data that I'm sure many of you are already familiar with in terms of some of the themes and some of the experiences that LGBTQ youth have as they kind of navigate the foster care system. So we looked first, of course, in designing the study at the issue of acceptance, and that was kind of the seminal piece or point and purpose of the study that we were doing. We also wanted to look at maltreatment experiences specific to what foster parents' responses were to kids being maltreated. So we'll talk about that as well. A lot of the research on double standards that LGBT youth kind of encounter as compared to straight youth, largely helped us kind of put together these series of questions, specifically with romantic relationships and friendships and extracurricular activities. We certainly wanted to look at the issue of pressure to participate in gender-conforming activities and in what things tend to be like for non-gender conforming youth. And then we also looked a lot at some of the research that kind of points to the streets as a safer place or a safer alternative for kids than the foster care system. And that's certainly a dynamic that exists here in Texas, and I would imagine one that exists in many of the states that you're calling in from. So that's kind of some of the research specific to LGBT youth, we drew largely from the Malin books and in just a little bit of research that's out there now. Of course, we wanted to look at permanency and some of the statistics that many of you are familiar with. About half of LGBT youth report that their most recent placement disrupted for reasons pertaining to their sexual orientation or gender identity. The research that points to the fact that LGBT youth seem to be reunited less with parents, much less likely to be placed in traditional foster care, and certainly the over-reliance that we typically see on group home settings and aging out permanency options and that sort of stuff. So that was very seminal in helping us to kind of put together these study questions. And we also looked at the Family Acceptance Project, the Family Acceptance Study, which I'm sure many of you are familiar with. Just a very seminal piece of research that essentially shows that youth from, or young adults from accepting families are significantly less likely to attempt suicide, significantly less likely to report depressive symptoms, significantly less likely to use illegal drugs and to engage in risky sexual behaviors. And that was actually probably the most important piece of research that we kind of looked at. So the idea for our study then, based upon that research, or those pieces of research, was essentially to get a better sense of what foster care acceptance looks like and what the differences are in the experiences of gay and lesbian kids who are in accepting families as compared to those in rejecting families. But to go a little bit further and to get a better sense of really what that acceptance and what that rejection looks like and what it feels like and what some of the thoughts and some of the emotions and some of the behaviors and some of the things that they were experiencing. So we really wanted to get, in doing these interviews, as much in-depth, as much detailed information, as much of the experience as we could possibly get for these kids. So it wasn't just a matter of, well, I went to my foster mom and told her that the kids were mistreating me, and she told me it was because I insisted on talking about my boyfriend. We know that data exists. We know that happens. But what we wanted to kind of get at is, okay, so you're at that point, and what is that like for you? What are you thinking? What are you feeling? What are your options at that point? So again, we really wanted to get at the experience of these young adults. So we interviewed alumni, primarily the Texas foster care system, between the ages of 18 to 25. We recruited them through private foster care agencies and in networks that we kind of have, that we know, alumni networks that really keep in close contact with these young adults as they age out of the foster care system. And so we initially were going to look just at kids here in Texas. But again, we wanted to compare, and this is really awful in terms of kind of looking at the state of what things are like here in Texas. But we wanted to compare the experiences of kids from rejecting foster families to those from accepting families, and we couldn't find enough kids here or young adults here in Texas who had accepting experiences. So we had to reach out to some contacts and some people that we knew back in Illinois and in Iowa, and do some phone and some Skype interviews with them so we could get a better understanding of what acceptance looked like. And I don't know if it just speaks to just Texas in general or the specific agencies and organizations that we were working with. But the kids we were talking to, the young adults, I should say again, that we were talking to over and over, again, had tons and tons of feedback and stories on rejection, but really couldn't share much insight for us here in the state of Texas on what that acceptance looked like, because they just didn't experience it. Or maybe they thought they had experienced it to some degree, but as I was talking to them, it certainly wasn't acceptance in any way that probably anyone in this webinar or anyone else would consider to be acceptance. So that's kind of the study sample. These are the young adults that we talked to. We did hour to about an hour and a half, maybe 2 hour interviews with them, really long ones with some of these kids. They had a lot of experience, a lot of story, a lot of emotion, a lot of thought to share with us. And then we just looked at what some of those themes are and kind of compared those themes, again, between those in accepting families to those in more rejecting families. So the issues that we wanted to specifically look at, again, drawing from previous research, we wanted to start with this issue of acknowledgement. We knew that much of the research out there really talks about acknowledgement as potentially the biggest barrier, the biggest challenge in foster care, in the child welfare system, in traditional foster care placements, in programs and agencies, the idea being that we just don't talk about this population of kids. I've done a lot of trainings and workshops recently with CPS workers across the state of Texas, and I'll ask them, you know, have you talked about this population of kids before? Have you talked about these issues before in a formal setting or training or something like that? And just about everybody in the room will raise their hand and say, no, this is the first time that we've had a training on this population or this topic, or that we've talked about this formally. So just simply acknowledging the presence of LGBTQ youth in our populations, in our foster homes, in our programs, in our transitional living programs, and that type of stuff seems to be a big barrier. So we wanted to look at that, and we wanted to ask kids, in the context of their foster family or in their foster home, what did this acknowledgement look like for you? You know, how comfortable were your foster parents in discussing issues pertaining to your sexual orientation? And then we had a lot of follow-up questions that we typically use in a lot of these interviews. So as they were telling us what their foster family's comfort level was and what these interactions look like, you know, we would ask them, in what ways did they advise you or require you to discuss issues pertaining to your sexual orientation? What did these conversations look like? And again, we wanted to get at their experience, so we asked a lot of, you know, what are you thinking, what are you feeling as you're having these conversations, or in many cases, not having these conversations. And we also asked them what they really felt like their foster parents' thoughts and emotions were as they were having these conversations, or again, not having these conversations, to get more at that experience. Next, we wanted to look at this issue of foster parent responses to mistreatment. So for those kids who were experiencing, you know, rejection in school or in the foster home or in other settings, or those kids who are experiencing bullying or harassment or teasing or stigma, that type of stuff, we wanted to ask them how their foster parents dealt with that. So in circumstances where you felt you were being mistreated by peers or teachers or other kids in the foster home, for issues pertaining to your sexual orientation, you know, what did a typical response look like from your foster parents? And we wanted to look specifically at what role they felt that their sexual orientation played, or what role their foster parents, felt that their sexual orientation played in that mistreatment. So were your foster parents essentially telling you, well, it's because you insist on talking about your girlfriend or your boyfriend, or you insist on talking about, you know, how proud you are, you know, to be gay or lesbian, that type of stuff. And then we would ask them how their foster parents kind of advised them to address these encounters. Did they advocate for you? Did they tell you go back and talk to your teachers and talk to your principals, or, you know, stand up to that kid, or, you know, whatever that looked like in that context. Next, we wanted to look at this issue of double standards. And essentially here we just wanted to first get these kids to, or these young adults to explain to us, you know, what these double standards look like. So how do you feel like you were treated as compared to straight youth in that same foster home or in that context, or just in general? And we were looking specifically at friendships with other LGBT youth or with kids who were affirming. We were looking at extracurricular activities. We were really interested in romantic relationships. Again, much of that previous research kind of alluding to the fact that, you know, these are the areas where many of these double standards really seem to be very, very strong. Interests, hobbies, extracurricular activities, that type of stuff. So again, we wanted to start there, but we wanted to go further and hear back from these young adults in terms of what they were thinking, what they were feeling, what they were experiencing when these double standards exist. So not only, you know, were these kids treated better than you, but what was that like for you? Let us get a glimpse of what that was like for you as you're seeing your, you know, foster brothers and sisters go out on dates when you're not allowed to go on dates, or bring their boyfriends or girlfriends over when you're not allowed to do those things. What did the behaviors look like? So what did you do in those circumstances where you couldn't have your boyfriend over or your girlfriend over? Were you sneaking around? That type of stuff. Of course, we wanted to look at permanency. Again, really getting a sense of, you know, what role sexual orientation played in the permanency process. So, you know, were your foster parents, you know, ever threatening you with losing placement for issues that pertain to your sexual orientation, whether they were overt or more covert types of things? You know, how do you feel like your sexual orientation might have impacted your foster family's approach, whatever their role was in terms of permanency? I know foster families don't play, or don't appear to play, much of a role in permanency. We know that they have a much stronger voice than many of us might think. in that role in a much stronger voice than many of us might be comfortable with. And then we wanted to look at this issue of running away. So for those of you who did ever run away from a placement or considered running away from the placement, what did that decision look like? You know, how is it that the streets could possibly be a safer place for you or a more appealing place for you than a foster home? And I think we really yielded some interesting results there. And the last thing, and certainly probably the series of questions that I think yielded the most important data or the most helpful data, most insightful data, is we just asked them to describe the ideal foster family. So I would sit with them. If it were a male, I would say, you know, let's imagine, you know, this afternoon I have to go place a 15-year-old openly gay kid in a foster home. Explain to me what the ideal foster family looks like for that kid. We're pulling up into the driveway. What should things look like? What should things feel like for that kid? Give me some specific characteristics. What are things that they should absolutely do? What are things that they should never do? What are things that they should absolutely say? What are things that they should absolutely never say? You know, how do they relate to these youth? How do they ensure that this young man is going to feel safe or comfortable or affirmed? That type of stuff. And again, I think they really yielded some, you know, really helpful information there. So I'm going to shift now and talk about some of these findings on these 5 areas. And again, I'll start with acknowledgement here. And so on the rest of these slides, I'll start first by talking about what the issue looked like in accepting, kids who had an accepting experience, and then I'll follow it with the next slide, kids who had, or young adults who had, a rejecting experience. So again, on this issue of acknowledgement, those who had an accepting experience talked about it as being very empowering and very liberating. The idea that they no longer had to have these uncomfortable conversations, they no longer had to avoid these conversations, really allowed them to tend to other issues in their lives, things that teenagers should be tending to. Another thing that I really found interesting was they seemed to have a lot of comfort and a lot of confidence in discussing issues of sexual orientation with others. So the idea was, and a lot of these individuals kind of alluded to this, was that, you know, if I could have these conversations and it was acknowledged in my foster home, I felt much safer and I felt much more comfortable in having these conversations with other professionals or other adults or other even kids. I could talk to my caseworker about it. I could talk to my CASA worker about it. I could talk to my teacher about it. This is a quote here. Foster mom was the one who encouraged me to talk about it with my caseworker. A very similar theme that came up was many alluded to kind of this pathway of discussing other delicate issues. And we know that this is a big challenge with kids, teenagers in foster care just in general. Foster parents tell us over and over, you know, they're just not talking to us about stuff that's very intimate, that's very personal, that we really feel like they should be talking to us about. And there are natural barriers that we can think of that exist there. But what some of these young adults were kind of alluding to with us was, you know, this was a pathway for me to talk about other sensitive, delicate, kind of intimate stuff. If I could talk to them about my boyfriend or my girlfriend, you know, then I felt comfortable talking to them about other sensitive stuff, right? And as you can imagine, a complete contrast for those in rejecting families. In fact, a lot of them, oh, sorry, are you still there? All right. A lot of them felt really discouraged from talking about issues of sexual orientation. Another theme that came up over and over was kind of this resentment and barrier to discussing other delicate issues. So almost the exact opposite. So where the kids in accepting families were telling us, you know, this was a pathway for me to talk to other people about this issue. The kids from rejecting families said, no, now this was a barrier. If I couldn't talk about it with my foster parents, then I was much more hesitant to talk about it with my CASA worker or my caseworker. The same dynamic kind of existed with talking about other delicate issues, as we can imagine. If I can't talk to you about my relationships or, you know, my boyfriend or my girlfriend, you know, I'm certainly not going to talk to you about any other sensitive or delicate stuff, whether it pertains to my permanency, my family, personal life, just regular stuff that teens go through. Many of them, of course, alluded to, you know, their foster parents being incredibly uncomfortable, a lot of discomfort, a lot of distraction. This is a quote here. When the topic came up, my foster dad would immediately change the subject. Sometimes he would just get up and leave the room. So a lot of discomfort, a lot of distraction. And again, we wanted to kind of get at what that felt like? What did that feel like for you? And I'm going to touch on that here in a second. So a lot of feelings of loneliness, a lot of feelings of confusion, certainly a lot of shame. And a big theme that just came up over and over, especially with the kids here in Texas, was just this internalizing that loneliness and that confusion and that shame, which is really troubling for me. Those kids from accepting families, they were able to externalize that. And, if somebody teased them or harassed them or gave them a hard time or were just completely incompetent in how they related to them, they were able to externalize that and essentially say, that's their issue, that's not my issue. Many of these kids from the rejecting families, I didn't get a sense in talking to them and following up on emotions and thoughts and that type of stuff that they were really able to externalize that. They internalized a lot of that. Well, maybe there is something going on here. So the way they responded, this is a quote, the way they responded and avoided it made me feel like they were ashamed of me. When family and people would come over, they would ask if I planned on talking about certain things. So a strong sense of internalization on a lot of these issues. So the next theme or the next issue we wanted to look at were what foster parent responses were to any type of mistreatment. So again, this could be bullying, this could be teasing, this could be, isolating, rejecting, any of that stuff. So again, those from accepting families, the caretakers really assume this role of an advocate or an activist. My foster mom would joke that I was going to get a bumper sticker that said that, my son has perfect attendance at the high school Gay Straight Alliance. There were several times where I had to take care of I would tell her I could take care of it myself, and I didn't need her to go down to the school and talk to the teacher. So essentially, this young man, really funny kid, talked about how he would have to tell foster mom, no, I got this. You don't need to go down there. I can take care of this. But you can imagine having a caretaker who's willing to do that. You can imagine how that impacts the relationship, how it impacts like these issues of externalization, comfort, permanency, all the stuff that we're trying to do in the child welfare system. Again, this incredible ability to externalize the mistreatment. So if they are being bullied or they are being harassed or they are being given a hard time, they had a much better capacity to be able to externalize that and say, not my issue, not my problem, right? And they were much more equipped to advocate for themselves. Those in rejecting families experienced a lot of blame, a lot of responsibility for mistreatment, and again, kind of getting at what that felt like, what that looked like. So I'll give you an example. We interviewed a young man who was in a foster home, wakes up one morning, finds out that his roommates had kind of vandalized his property, written the word faggot all over his books and backpacks and stuff. Just really awful thing. Now, this kid's been openly gay in the foster care system for a while, not the first time he's been called that, certainly not the first time he'd had his stuff kind of vandalized. Goes to foster mom, tells her what happened. Before he could even finish telling her what happened, she's just telling him how it's his fault and how he knows that the boys aren't comfortable with him talking about his boyfriend and what they do together and that kind of stuff, essentially kind of saying you had this coming. And we know that exists, and research has told us for a while that exists, so I wanted to get at, what's that like for you? What are you thinking at that point? And he says, I have an option at that point, and I'm really deciding, is this a place that I'm going to stay? And I decided at school that day that I'm not going to stay at that place. Goes home, packs his bag, never returns, stays with some friends, does some couch surfing, and winds up in an emergency shelter when he gets back in contact with CPS. So a lot of blame, a lot of responsibility for mistreatment. So here, some quotes here. One time I told my mom that my group of friends no longer wanted to hang out with me, and they started to avoid me, and all she said was, maybe they're on to something. Often punished for mistreatment. So this was an example here. A kid kind of got upset that his roommates in his group home wouldn't let him into his own room. He said, I got dropped a level, and my foster mom said that she couldn't make them accept me. And then probably the most prevalent one was this issue of indifference. So they were coming to foster parents, telling them about the bullying or teasing or harassment, and the foster parents just essentially acted as though they really didn't care or certainly didn't do much about it. In terms of double standards, again, those in accepting homes, a lot of intentional efforts to establish equality. One thing that seemed to be very clear in a lot of these homes is these foster parents had policies or rules, whether they were written or unwritten, that you just don't tease and you don't bully and you don't harass on any issues. It doesn't have to be specific to sexual orientation or gender identity. But that seemed to be, especially important to a lot of these these kids or young adults. A lot of efforts, intentional efforts to connect youth with other LGBT youth or affirming peers or organizations and groups, that type of stuff. Support for romantic relationships, that seemed to be really, really important. And again, we wanted to get at what that felt like for these kids or for these young adults. And, what does it mean to you to have a caretaker who, allows you to go on dates or provides transportation for you to go on dates or have, your girlfriend or boyfriend over or your friends over. And so here's a quote. I really like this one. On my first day, my caseworker told my foster parents that I had a girlfriend and that I wanted to keep seeing her if it was possible. They said that they would make sure that that happened, and I knew at that point that I wasn't going anywhere. Many of them kind of expressing feeling a part of something, and a lot of intentional efforts to connect them to resources and activities. So you can imagine, what that feels like for a kid, especially here in Texas. Let's imagine this is a kid who's bounced around 6, 7 different places. We have in Texas, we recruit primarily from very conservative, faith-based foster care organizations and groups. Very hard to find, just foster families in general who are affirming and accepting. You can imagine you get to a home where you're experiencing that, and all of a sudden you have foster parents who say, yeah, we're going to make sure you get to see your girlfriend, or you're going to make sure that your girlfriend's able to come over and that things are, the same for you as they are for, the other kids in the home. You can imagine what that feels like for this kid, and they certainly really shed a lot of light on what that felt like. Rejecting families, everything that we would probably imagine. A lot of what previous research has kind of alluded to before. A lot of isolation with these kids. They weren't allowed to connect with other LGBT youth or with peers or friends who were affirming. Certainly weren't allowed to go on dates or have boyfriends and girlfriends over. One kid kind of joked about how his foster siblings could, practically be on second base with their girlfriend on the couch in the living room with people walking by, but, there was just no way that he was going to be able to, have his boyfriend over for dinner. Even the idea of it would probably mean that he would lose his placement. They were always monitoring who I was hanging out with. They would also ask the other foster kids in the home which of my friends were gay. Another quote here, everyone was allowed to have their boyfriends over, but whenever I asked to have my girlfriend over, they would tell me it depended on whether she was coming as a friend or as a girlfriend. And then the issue of permanence. And really what kind of struck me here was just how important that permanence was, and just how important kind of that acceptance, or not so much the acceptance, but really just not having to worry about these issues anymore, either not having to worry about being outed, or not having to worry about really uncomfortable or awkward or hostile conversations, how that really allowed them to focus on all of the things that you would hope a teenager would be focusing on. I could focus on other stuff in life because I didn't have to worry about this anymore. I could focus on things like school and college and grades. Another theme was just a strong sense of relief. When I was with that family, there wasn't any tension, and it was out in the open, and I didn't have to worry about it. And then this last one I really kind of liked, and this was this kind of tendency to overlook the shortcomings of foster parents in other aspects. So essentially the idea here was, a family could be maybe a little bit too rigid, or they could have specific things that these kids didn't like necessarily, things that maybe previously would have really bothered them or potentially caused some conflict in the placement. But if they were accepting, in many cases, these kids were able to or willing to kind of overlook some of that stuff. So here's a quote. It was like I didn't care about the other rules. If they were willing to be cool with me being a lesbian, having a girlfriend, then I didn't really care about any of that other stuff. So again, this kind of potential to overlook some of these inadequacies or some of these shortcomings of their foster parents. In terms of permanency in rejecting families, the big issue here is just this persistent fear of losing placement. We've heard that in previous studies, but again, we wanted to get at what is that like for you? What is it like constantly worrying about losing your placement for issues related to your sexual orientation, or being outed or being caught with your boyfriend or your girlfriend? In fact, we had one kid who talked about how he would intentionally have emails intercepted, or he would intentionally leave up emails from a girl, a friend of his that he apparently made this arrangement with, to convince his foster parents that he was in this straight relationship, or he would have love letters intentionally intercepted so that they wouldn't think that he was in a relationship with a boy who they knew he had previously been in a relationship with. So some quotes here again. I knew the second that they found out they would make me leave. You always have it in the back of your mind that this placement's going to end soon. I used to be in one place and already be thinking about what the next place was going to be like. It's hard to explain, but it really kind of messes with you. And then, of course, many alluded to kind of the alternatives, the streets being a safer alternative. I was on Guadalupe. Guadalupe is a street in Austin, Texas, if you're not familiar with Austin, that has a high population of homeless youth. So I was on Guadalupe for a while. Honestly, I liked it better than some of my foster homes. At least I was accepted and had friends. I would rather have that than a home where everyone hates you and makes your life hell just because you're different. And then the last area, we just told them, explain the ideal foster family. Again, I've got a 15-year-old openly lesbian teenager, openly gay teenager. I've got to go place them this afternoon. What would be the ideal family for that kiddo or that teenager? And, of course, all of them started with accepting. Many of them alluded to being very non-judgmental, valuing people's differences. I would tell a family to be open and not be afraid of something or someone that they know nothing about. I felt like families decided that they didn't like me or things about me long before they ever got to know me. Another quote, the perfect family for a gay teen is one that just accepts him. That's it. They can be too strict or have too many rules. As long as they accept kids for who they are, they're going to be pretty good foster parents. So, and of course, they got more specific in terms of, having, books or having signs, that type of stuff that a kid could walk into and immediately be able to identify that as a safe space or a safe home for them, or being intentional in some of the initial conversations that they have with these kids in mentioning that, they are an affirming family, an accepting family, and, they're certainly not going to treat somebody differently based on things like sexual orientation or gender identity. Avoid assumptions. Many of them talked about just many of the assumptions that were made. Never assume that a kid is straight. As soon as someone would ask me how I was doing, if I had a girlfriend or how I was doing with the ladies, I would immediately assume that they weren't a safe person to come out to. And then they really talked about foster parents as advocates, getting out there and advocating for these kids and not being afraid to, get out there and engage in some of these conversations and conflicts that they might be having at school or in other settings. So in terms of recommendations for practice, I know I'm running out of time here, or I am out of time here. Of course, when we go around and we talk to foster parents and we talk to CPS workers, we always start with this issue of acknowledgement. Again, many of them, especially foster parents, have never talked about this before. And even in doing some of these trainings and doing these conversations, you can see the discomfort in many of them in having these conversations. But we tell them, we know it's uncomfortable. We know you probably don't have the adequate training that you should have to have these conversations, but you have to acknowledge that there are, LGBT kids in our homes and in our programs and in our offices, and we have to acknowledge that. Especially here in Texas, we really need specific efforts to recruit affirming and accepting families. The way that our system is structured and set up, a huge majority of our foster homes are licensed and run through private, faith-based, very conservative children's homes and foster care agencies, and they do wonderful work, and I'm sure very sweet people and do great work with certain kids, but I can assure you when it comes to LGBT kids, they're not doing wonderful and great work in a lot of cases. In many cases, it might be an issue of training, but in a lot of cases, it's more ideology and theology and in that kind of stuff. So we really need more accepting and affirming families and being intentional in finding those small pockets in a state like Texas to go out to progressive churches or progressive neighborhoods to recruit those families. Certainly educating on the consequences of rejection and the benefits of acceptance. I know with the Family Acceptance Project, they've been pretty successful in sharing some of that research with parents and in letting them know that what their response is to a child coming out can largely influence whether or not they develop suicidal ideations or depression or substance abuse or risky sex, that type of stuff. And I would imagine to some degree that dynamic might exist in foster care too, with foster parents as well. So we need to educate foster parents on the consequences of rejection and what that looks like and what that could potentially mean in a lot of these areas with these teenagers and kids. Certainly develop anti-discrimination policies. As many of you know, in doing this work, it's a very easy process. There are a lot of models out there for agencies to look at. Sometimes when I do this training at agencies, I'll devote the last 10 or 15 minutes to helping them kind of draft an anti-discrimination policy and let them know what that would kind of look like and how easy that is to do and what the implementation might look like. Recruit mentors, role models, and sponsors who are affirming and accepting. So, you know, if you can't find the foster families or you don't have the resources or to find foster families, you know, many of these organizations have these role model programs and these sponsor programs, and they can be very intentional about going out and finding people who are accepting and who are affirming. And then specifically create policies addressing this issue of double standards, because what we're hearing, especially from the kids in Texas, that really seems to be a big problem, and there seems to be one standard for straight kids and a completely different standard for LGBT youth. So being specific about that. And then that's all I've got. I've got my reference page here. But I guess the next part, Bill, is a Q&A. Is that right?
Yes, that's right, Adam. And thanks so much. This is really, really valuable information and very timely. So there are a few questions, follow-ups. And if others have any that come to mind as I'm talking with Adam, please send them in. Can you tell us a little bit about the demographics of the youth?
Sure. It was primarily white. I think it was 16 or 17 kids who were white, only 2 Hispanic, and maybe 3 or 4 African American kids. So it was largely Caucasian population, predominantly male. I think about 3/4 of them were male. Probably 14 or 15 of them were male. And again, I mean, we were really, you know, we wanted to be much more intentional in terms of getting a more diverse population of young adults to interview, but it was just tough here in Texas. A lot of barriers to identifying these kids, and oftentimes when some of them were identified, you know, going out and interviewing them, we had to interview them on specific dates. So I just traveled. I went to Austin, San Antonio, Dallas, and other parts of the state, like during, you know, a short period of time. So we couldn't be quite as effective as we'd hoped to be in terms of getting a more diverse sample. Am I still on here, Bill?
Hey, Adam, this is Jonathan. You're still on. I'm not sure what happened to Bill, but we have a couple more questions that came in. Are you still there?
Okay. Yeah, I'm still here.
Okay, so another question is, do you have more information about the training you would provide to foster families in order to be more accepting, to understand the experience of LGBTQ youth?
Yeah, you know, we haven't done too much. We've only done a couple of these and kind of teasing it out a little bit and getting a better sense of what that would look like. But you know, really, it starts with, I think, talking about the consequences of rejection and the benefits of acceptance. A big piece, you know, devoted to the issue of acknowledgement, and then just basic things that they can do in terms of addressing assumptions of, you know, when they're having these conversations, just some tools and some skills that they can have. And then I have a colleague, Catherine Schmidt, who just does a wonderful job in terms of what we find. She recently did this with caseworkers, CPS caseworkers here in El Paso. You know, she just goes through all the terminology and explains what the terminology means. She does just this wonderful job and does the, you know, the whole gingerbread person and in all of that, because what what we know is they don't have that knowledge and they don't have that competency, and the assumption is that not having that knowledge or not having that competency, not having that terminology seems to be a big barrier for them in having these conversations. So she does a really wonderful job in just getting it out there. But we're always telling them, even if you don't have the terminology or you don't have the right words or you don't feel that you have the right words, don't allow that to be a barrier to not talking about these issues. And we'll tell them, let's imagine there was a group of 15, LGBT kids here in the foster care system. They would be telling you, even though you don't have the terminology, sure, you want to get that, you want to be much more confident in having these conversations and intervening, but they're going to tell you, we want to talk about this. Don't allow that to be a barrier. Don't keep that from allowing you to talk to us and have these conversations and acknowledge, issues related to sexual orientation or gender identity.
Thanks so much. Can you speak a little bit to the role and importance of intersectionality in studies like this, and how multiple experiences might shape the different in various ways that LGBTQ youth interact with child welfare systems?
Sure. I mean, I should have, and I meant to start by talking about the kind of limitations of, a study that's so small, even though it's qualitative and there were long interviews and, we got a lot of data, and I think we got some really good insight to help kind of create some theories that we could maybe go out and test and put together some surveys. And I know we've put together some that we've sent to the Get Real people, and, they've been very good about sending those back and kind of providing a very helpful critique for us. But we're just looking at the experiences of a few young adults. So in terms of generalizing, based upon these 21 individuals, most of them in a very, very conservative child welfare system, I'd be very cautious in going too far. Maybe unless you're in a neighboring state like New Mexico or Louisiana or something like that that probably has similar challenges and issues related to that. So I'm very careful about that. And I can imagine, if we just interviewed kids in Chicago or in a place like Boston or California, the experiences would be much, much different. Or at least I would hope they would be much different. So is that kind of what they were?
Yeah, I think, absolutely. Okay. Thanks so much.
Sure.
So the True Colors Fund in Connecticut does a lot of foster parenting training and has curriculum. Just letting folks know, Robin is sending out a message to everyone, letting folks know that she also has curriculum around these issues that she can share with folks if they're interested. So let us know if you would like us to send that along. Another question is, did youth describe a variation in the level of acceptance by foster care parents? For example, were some tolerant but not at full acceptance? And what, if anything, did the youth say about that?
You bet. I mean, it just ranged from, just very accepting families who were, you could tell, just very intentional, to the point where many of them would kind of joke about it, like, yes, I got the message, to just kind of indifferent about, that seemed to be pretty prevalent, just kind of indifferent, and we certainly included that in the more rejecting experiences, just kind of knowing what that indifference, could mean to some of these kids, just to downright just blatantly rejecting, if they knew that I were gay, or as soon as they found out that I was gay, I got kicked out. They were calling CPS. 2 days later, my bags were packed, So yeah, there certainly was a range there. And really, and I didn't know how better to do this in terms of the methodology, is just have a kind of brief conversation with them and talk about, so many of these kids kind of said, well, I think I had an accepting experience in this one family, and I would have them talk about it, and there was just no way. I mean, it wasn't that it was accepting, it was that they, just weren't completely hostile towards the kid. And so, as we were kind of writing that up and looking at this, it was, well, that's not acceptance. It's really awful and sad that this kid might think that's acceptance, but just the fact that the family just wasn't completely hostile towards them, they kind of viewed that as being accepting. So, and again, you can imagine the consequences of that for a 18, 19-year-old kid.
Yeah, absolutely. Can you speak a little bit to, because so much of this is and I'm just thinking of your comments around not even being able to find accepting situations in Texas and having to reach out to other states to also bring that discourse into your research. Can you speak a little bit into efforts in Texas to change the narrative or to challenge existing narratives when it comes to accepting families around LGBTQ youth and specifically around views of LGBTQ issues?
Yeah. So in terms of efforts, I'm not aware of too much that's going on here, but it certainly is problematic. I did a big Title IV training about a month back in Dallas with a whole bunch, about 100 CPS caseworkers, and I put them in different scenarios and asked them how confident they would be in finding a family who was affirming or a family who would support romantic relationships for LGBT youth in all of these different situations. And there were probably in this group of about 100 on most of these scenarios, maybe 2 or 3 would say, yeah, I think I'm confident that I could find that for a kid. And it was just based solely probably on 1 or 2 families that they knew of. So when I went out and did this training and talked to, and we did it here in El Paso as well with foster parent or caseworkers here in Texas, they're essentially kind of telling me like, I think that you probably think things might even be a little better than what they really are here, especially in Dallas and here in El Paso, where there just aren't many resources or many efforts to do anything specific for this population. But there's certainly a need here, as I can imagine anywhere else. But in Texas and in foster care, child welfare, we're always or tend to be well behind the curve. So when I read about some of the efforts that get real in things like the True Colors Initiative and that type of stuff, we could really benefit from a lot of that stuff here in Texas.
Well, thanks so much, Dr. McCormick. It's been great to hear from you, and we were excited to have you come on and present your work for this webinar. We really appreciate that.
Sure. Thank you so much.
So for everyone, we thank you for joining this webinar. Just keep in mind that we will have another webinar next week on Wednesday, November 12th at 2 p.m. So we will send that information around to the Get Real Network once again. So you can please register for that webinar and go to our website if you would like to see the series of webinars that we've been doing throughout this entire year. And you can just get to the Get Real Network by going to uic.edu/GetRealBlog, and we'll send out the website for any folks who don't have it. So thanks so much for joining, and we look forward to seeing you all and hearing from you all soon. Have a good one.